Do 12 is on the posterior midline, below the spinous process of T3. Do 14 is on the posterior midline, below the spinous process of T7 in a depression. Bladder 11 is 1.5 cm lateral to the posterior midline, below the spinous process of T1. Going to find the inferior border of T1 and come directly lateral to it on the height of the paraspinal muscle.
Small intestine 11 is found at the junction of the upper third and lower 2/3 of a line joining the midpoint of the inferior border of the spine of the scapula and the inferior angle of the scapula. It roughly makes an equilateral triangle with small intestine 9 and small intestine 10, but this is not always accurate. To find small intestine 11 accurately, you first need to identify all of these landmarks. To find the medial border of the spine of the scapula, place your hand on the back where you think the medial border might be. If it's not palpable, a slight amount of pressure on the shoulder will help to bring the medial aspect of the scapula into relief. To find the lateral extremity of the spine of the scapula, palpate along the spine until you find a bump at its end. Be careful not to go completely to the end of the shoulder. This is the end of the acromion process. It's not the end of the spine of the scapula. To find the inferior angle of the scapula, palpate down the medial border until you can find the scapula changing direction at its bottom. Once again, if this is not palpable, it may help for the person to put their arm behind their back. This will bring the angle, the inferior angle of the scapula, into relief. It's important to remember that once you've located it, you need to keep your finger on it as the person moves their hand back. Do 20 is located in relation to the midpoint between the glabella and the occiput. Place the heel of your palm on the glabella and the occiput. Fold your fingers around the skull to find the midpoint. Do 20 is located 1 cm posterior to that midpoint. It typically lies in a nice dip. There are several other nice dips slightly further back, which are other dew points, so don't be tempted to go further back than 1 cm posterior to that midpoint. Do 26 is on the anterior midline at the junction of the upper third and lower 2/3 of the philtrum. Bladder 4 is located 1/2 cm into the anterior hairline, 1/3 of the distance from do 24 to stomach 8. Bladder 4. Bladder 10 is located 1.3 cm lateral to do 15. It's 4.5 cm from do 15 to the mastoid process. So divide this area into 3 and just come a little closer to the posterior midline. You'll be on the lateral edge of the trapezius muscle. To locate gallbladder 20, palpate up the groove in between the sternocleidomastoid and trapezius muscles. As you get to the base of the occiput, you will find a nice depression. Gallbladder 20 is in the centre of that depression. Sanjiao points on the forearm are best located with the arm laying flat on the bed and the elbow turned outwards. To find Sanjiao 5, come 2 sun proximal to Sanjiao 4, in between the radius and the ulna. You should be on the radial side of the tendon of extensor digitorum communis. If the person wiggles their fingers, this tendon will come into relief. Sanjiao 7 is located 3 sun proximal to Sanjiao 4. It's in between the radius and the ulna, but it's on the ulnar side of the tendon of extensor digitorum communis. This tendon comes into relief when the fingers are wiggled.
Pericardium 5 is on the flexor aspect of the forearm. It's 3 sun proximal to pericardium 7, in between the 2 tendons of palmaris longus and flexor carpi radialis.
Small intestine 3 is on the ulnar aspect of the hand. It's in a depression which is proximal to the head of the 5th metacarpal. It's in between the metacarpal bone and the muscle, and it typically lays on a level with the distal palmar crease.
Small intestine 7 is 5 sun proximal from small intestine 5 on a line connecting small intestine 5 to small intestine 8. Running my finger down between the anterior border of the ulna and flexor carpi ulnaris. Small intestine 8 is between the olecranon process and the medial epicondyle of the humerus. Make sure you don't have the arm fully flexed for this point because it will be impalpable. Large intestine 1 is at the radial nail point of the index finger. I'm going to be looking at the proximal and radial borders, looking and feeling for the flare of the bone, looking at where the nail bed is and putting my point in. Large intestine 4, you're going to find the length of the 2nd metacarpal bone. So running your finger down, finding the base, making sure that you're not actually on the carpal bones themselves, finding the midpoint of that shaft of bone, coming between the 1st and 2nd metacarpals, nearer to the 2nd than the 1st in the muscle.
Large intestine 10 is located 10 cm proximal to large intestine 5 on a line heading towards large intestine 11. Palpate along that line and fall into a nice groove in the muscle at 10 cm. Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Lung 5 is located on the transverse cubital crease in a depression which is just radial to the aponeurosis of biceps brachii. This point has a nice soft swampy feel to it. Be careful to not go too radial and to fall onto the tendon of brachioradialis. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 cm inferior to the inferior border of the patella. Stomach 41 is located on the anterior aspect of the ankle flexure. It's on a level with the prominence of the lateral malleolus. It is located in between the tendons of extensor hallucis longus and extensor digitorum longus. To reveal extensor hallucis longus, get the person to pull their toe up against resistance. Locate this point in a nice dip just lateral to that, actually in the ankle joint. Articulate the ankle to make sure you are actually in that joint. Spleen 6 is located 3 cm superior to the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. Be sure not to place this point actually on the bone.